The following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents. Tonight we're talking about a topic that affects a majority of Americans, adoption. Whether you've already adopted a child or whether you're considering adoption, our show tonight is for you. First, let's meet our experts. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist, and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Good evening.
Dr. Lowenstein, tell us about adoption and the adoption experience. Is it a growing trend? Who's adopting? Who's being adopted? And is adoption generally successful?
Well, adoption is a very common fact of life for at least 1 million families in the United States. Approximately 120,000 children are adopted each year, and it affects maybe 2 to 4% of the population. So it's a very common fact of life. 6 out of 10 families, for example, are affected by adoption in some way or other. Adoption generally works out very well. It's a very positive experience for most of the families. The people who adopt children generally are more stable, generally are able to provide the children with love, attention, affection, care. They generally stay married, stay out of trouble, and keep the children and do very well with them. So that it's a very positive experience in general for most families. There are problems with the adoption process, which we can get into, but that's rare.
Now, Dr. Carasso, tell us a little bit about the different types of adoptions.
Yeah, there are different avenues that a child may go through in terms of being adopted. There are public adoptions. That's an adoption that's overseen by the public welfare system. Now, historically, that was one of the predominant ways of adoption being processed. But more and more, the state is contracting with local licensed agencies to oversee the adoption process. And that's a private adoption. There's also independent or non-agency adoptions. That's where a child is placed directly by the birth parent with a non-relative. However, even in that situation, those adoptions are overseen by a certified medical doctor, a clergy, an attorney, so they're still facilitated with those as well. There are kinship adoptions, where that were a very common experience, where we'll see a grandparent adopt a grandchild, for example, or a step-parent adopt a stepchild. There are also international adoptions, which are growing significantly. Numbers have tripled since the early 1990s. And of course, that involves adopting a child from another country, China, Russia, whatever the case may be. Those categories are not definitive in the sense that there are overlaps between them, but it gives a general sense of the various ways that adoptions take place.
How and when should a parent tell the child that they are adopted?
Well, to begin with, it's best to tell the child that they're adopted before somebody else tells them. So the best rule of thumb is don't let somebody else tell your child, especially if they're an adolescent, that they've been adopted. Children need to learn that somewhere along the way prior to adolescence, and they need to hear that from the adoptive parents. The question as to when to tell them that they're adopted is open to some controversy. Some people think earlier the better, others do not. The important thing, though, is that both adoptive parents should meet with the child, tell them in a matter-of-fact way about the adoption, let them know that they were loved, they were not rejected by their biological parent, that they weren't cast aside because of something bad they did, and that they're loved by their adoptive parents alongside any other children they may have had between them.
One of the beauties of adoption is that the child is chosen. So, and that's what we want to focus on when we have those discussions with children, is that they were picked out by the parent.
And in many cases, there are more single-parent adoptions, aren't there? I mean, I personally have known at least three women who have chosen to adopt on their own.
Yes.
So that's
Absolutely,
also,
absolutely, and that also tends to heighten the child's sense of belonging, of being loved and wanted. So that becomes a very positive experience for them.
All right, we're going to take a short break. We're talking about adoption tonight on Community Psychiatric Centers Presents. We'll be looking at all of the good things that happen and also some potential problems and treatment options when we come right back. You're watching Community.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
Sometimes we joke and say, hey, buckle your seatbelts, because we know that anything can happen that night.
We're always trying to figure out how to get the news to you as quickly as possible.
News is in motion. It is something that never stops, so we never stop.
At Channel 11, there is never a slow news day. We all know the mission, and it's to bring breaking news to the audience, to bring local news to our viewers.
We are there live on the spot with information that you need to know.
Of course it's fast. It's Channel 11 News. It's who we are.
Welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about adoption tonight. And Dr. Lowenstein, we've talked already about the rates and types of adoptions and that it's generally successful. But what are some of the things that can cause problems?
Right. When adoptions go bad, or when foster care parenting goes bad, it's usually due to the presence of behavioral problems that the child presents in the home. The kinds of things which precede that are things like parental expectations being unrealistic, or parents being unprepared to accept a child into their home. Also, the child brings to the table, so to speak, their own emotional problems and their own past history. They may have had an early history of abuse and neglect. They may have been traumatized. They may have witnessed abuse in the home, and they may also have other psychiatric or mental health diagnoses to which they bring to the family. When these things converge together in a family, then things begin to fall apart in the adoptive process.
Dr. Carasso, tell us more about the connection between a child who has experienced some of these experiences or traumas and subsequent behavioral problems later.
Sure. It's interesting. We as adults, we tend to think, have this mindset that what happens to a child during the first few years of their life, especially the first 2 years of their life, doesn't matter a whole lot. We have no memories of that period of time, so does it really account for much later in life? Well, actually it does. It could even be said that what happens during those first 2 years could even be more important than what happens in the next 7 years in our life. Keeping in mind that research has suggested that about half of what we learn in terms of life, our attachment to other people, survival skills occurs within that first year of life. About 25% more occurs the second year, and then over the course of the following years, about 25% more. So again, during that first two years of life, it's an extraordinarily sensitive and important time for development. Children are learning a tremendous amount about how other people are going to treat them, how to act, how they can be expected that other people will act toward them. An example might be this. Say there's an infant in a crib and they're crying, okay, and the caregiver comes and picks them up and comforts them, loves them, nurtures them, and this happens repeatedly over the course of days, weeks, months, years. Well, what does that child learn? That child learns that when they're in distress that they'll be comforted, loved, cared for. But that does lots of things, and lots of developmental processes go on that are rather complex, but it helps the child to get a sense that they have a strong sense of self, that they then develop a sense of compassion and empathy, a conscience. These things all develop. Now compare that to a child who cries in a crib, parent doesn't show up, or when they do show up, they're abusive in some way, or they show up sometimes and don't show up other times. Well, that child, just the opposite happens. There's a tendency to develop a weak sense of self, empathy is lacking, conscience is lacking, and their ability then later to form appropriate and quote-unquote normal relationships in terms of understanding bonding and attachment and being able to attach to other people can be significantly disturbed. And so we see that what happens during those first 2 years is tremendously important. And additionally, in terms of the behavior problems, that abuse and neglect that can occur early on can produce a significant, it's difficult even for us to even comprehend the rage and the anger that can form within even an infant at that young age. It then manifests later in behavior problems like oppositionality, temper outbursts. So it's vital that we as adults and parents take very seriously those first 2 years of life and that we treat the child accordingly.
You hear a lot about that in orphanages where there's so many children to care for.
Exactly.
Maybe the caregiver doesn't get there as often as they would like, or the ratio's off. Is there a specific diagnosis for this?
Yes, there is. As a matter of fact, this was first described by a researcher called Renee Spitz, who went into an orphanage and observed children in England who were well cared for from a physical perspective. It was clean, they were fed, but they didn't receive a lot of emotional caring, a lot of one-on-one attention, a lot of holding, a lot of nurturing and affection. These children developed a condition which was called anaclitic depression. Anaclitic depression describes a child who is sort of sad-looking, depressed, unresponsive to caregivers, sometimes very crying a great deal, avoiding contact with other people who try to even comfort them. Currently, we call that condition reactive attachment disorder. And that's a condition that starts occurring by the age of 18 months. Certainly by the age of 5, it's diagnosed. There are 2 forms of that. One is the inhibited form, in which a child, a young infant, a toddler, is either unresponsive to adults in their environment, somewhat irritable when picked up, insensitive to pain. As they grow older, they tend to also inflict pain on others, on pets, and lie. And then there's the disinhibited type, in which the person, the little child, has attachments to people that they don't know. Just perfect strangers, they'll go up and give them hugs. And they're relatively indiscriminate in their attaching themselves to strangers. Children with RAD can have both of these types of symptoms at the same time. As they grow older, these children may develop signs of conduct disorder. They may lie, steal, cheat, do whatever it takes, so to speak, in order to get their needs met. In adulthood, they often engage in antisocial behavior, in criminal activity, don't seem to care about other people, only care about themselves.
So I guess that begs the question, are children who are in a position to be adopted then more prone to display signs of RAD?
No, I mean, not necessarily. Clearly, children who have been removed from the home, who are placed up for adoption, that's always a concern. Parents need to be prepared for that possibility, and that's one of the things that Dr. Lewis and I encounter so frankly frequently, is where parents are in adoptive situations or foster care situations, and they have a child who's showing signs of attachment disorder, and they don't understand attachment disorder, and they don't understand how to deal with it. That's a serious issue. There are a number of risk factors that people need to be aware of, especially people who are going to adopt. And again, we don't want to dissuade adoption. I think it's a fantastic thing. It's a gift to the parent, to the child, and as Dr. Lewis mentioned, the vast majority of adoptions turn out wonderfully. But there are some risk factors that need to be considered, and that would include anything that interferes with a caregiver providing adequate attention, love, nurturing to a child over the course of time. Again, as was mentioned, children in orphanages or institutions, children whose parents have mental illness like chronic depression or postpartum depression, so they can't be as responsive to their child. Of course, abuse and neglect and those types of factors can weigh heavily to weight a child toward attachment issues.
The issue is one of trust. These children don't learn to trust any human being. They're often shuttled from one foster home to another. They're often in various placements. And early in life, they don't have a single parent to which they can attach and learn the sense of trust, that the world is a trusting place in which they feel secure. When children don't get that, then they spend the rest of their lives avoiding contact with other people, or having indiscriminate contact with strangers, or caring for their own needs over those of others.
I know that the adoption process is really a lengthy one. Is this one of the things that ever comes up? I mean, is it something that you were talking about?
It is the issue. It is the issue, especially if a child is adopted from foster care. One of the things that's so traumatic for a child is switching from foster care home to foster care home. It's interesting. We call it placing them elsewhere, but we should refer to it as traumatizing the child. It's a trauma. Every time they make that switch, imagine a young child having to make that adjustment from one home where they know nobody to some other home where they don't know anybody, and making that adjustment each time is genuinely traumatic.
All right, let's go to our email file. Here is a question from a viewer. I plan to adopt an infant from China. How can I know if the child will have attachment problems later on, and what can I do to help the situation?
Well, the first thing a parent should do, if they can, is go see the child before they adopt it. Mm-hmm. Go look at the foster home or the orphanage from which the child is coming. Try to get as much of a history of the child as possible. Find out about the biological parents, if it's possible, whether or not they've had any problems either emotionally or physically. Find out if there's been addiction or alcoholism in the family. The child was born with fetal alcohol problems. Try to observe the child as they interact with other people as well. You get a really good sense of that by on-site visits.
What's so important is that if there's any inkling of attachment issues that could come to the surface, it's vital that that potential adoptive parent seek professional assistance, because there's so many things that need to be happening for that child during that initial adjustment process. Any number of things that would include one primary caretaker, one person spending the bulk of the time with that child, changing, feeding, bathing that child, spending the time with that child, tons of eye contact, multiple things that need to happen that are vital the parents just don't know about. So they need to seek professional, they need to call us and talk to us about this.
Mm-hmm. So to be clear, you're not saying don't adopt that child if they may have the risk. Mm-hmm. It's just that you need to be aware of what you will need to do and to face.
These children can heal. They can heal, but they won't heal unless they're given the proper attention.
Right.
All right, we're going to take a short break. We'll be back with more questions for our doctors right after this. If you have a question for our doctors, you can log on to their website, cpcwecare.com.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
Welcome to Community Psychiatric Centers Presents. We've been talking this hour with Drs. Carasso and Dr. Lowenstein about adoption, and we just want to go over a few things. We were talking about this attachment disorder that some children who will be adopted may develop or may have. And Dr. Lowenstein, what if a parent finds out that their child has this? Do the traditional ways of managing it work?
Well, the first thing to do is when a child presents with these kinds of symptoms in the home, they need a thorough evaluation, either psychiatric or psychological evaluation, in order to make the correct diagnosis. There are other conditions which may look like RAD that are not RAD, such as pervasive developmental disorder, post-traumatic stress disorder, oppositional disorders, and others. So it's very important to make sure they're dealing with RED and not something else. And also those conditions can coexist with RED. Once the diagnosis is made, treatment approaches with RED are somewhat different than they are with the other conditions. Treatment approaches with RED don't involve as much of the behavioral interventions that deal with negative consequencing of a child, such as timeouts, for example, don't work well with RED children. They respond quite badly to it. So the general approach with treatment of RED is to try to first set limits on their behavior in a positive way, and then to try to explore the child's needs for love and affection and the kind of barriers they put up to receive it. The involvement of the parents in the treatment is essential. It's really difficult to treat these children alone. They need to be treated as a family unit.
Dr. Carasso, would a parent do if they caught their child who's been diagnosed with RAD making a mess and then not being truthful about it?
Sure. Dr. Lowenstein's point about not being avoiding the punishing consequences is very well taken. The impulse for most parents is to, in such a situation, become angry, show that emotion, and then punish in some way. We want to do the exact opposite for a child who has attachment issues. Not that we don't set limits and have consequences, but we do so with the utmost of compassion and empathy. What we use is the phrase time in as opposed to time out. During those times where the child is attempting to emotionally distance themselves from others by misbehaving and acting up, we wanted to do just the opposite. So a response to that might be something like, Johnny, I'm looking forward to the time when you feel comfortable to tell me the truth. In the meantime, let's work together and clean this up. And so again, it's bonding with the child during those most difficult times, which, by the way, is extraordinarily difficult for parents to grasp onto. Our inclination is to get emotional and punish, and it's very, very tough at times to move beyond that into other alternatives.
Especially if a parent has grown up,
definitely.
They're reacting
old school,
the way that they learned when they were growing up, but it doesn't work, obviously, with RAD children.
Yes, and it's quite disappointing to the parents who are giving the child a lot of love and affection and have adopted them, and then they get a negative response from the child who lies or who acts out as if to push the parent away. The more they do for them, the more the child pushes them away, and then the child goes to a perfect stranger and acts perfectly lovely and affectionate. Very frustrating for the parent.
It takes extreme patience on the parent's part, and they cannot take it personally. We have to continually remind them, this is not about you, this is about the child. And it's important that they contain and control their emotions in that respect.
Does medication help in any way?
Well, if the child has other symptoms or conditions associated with RAD, it can help. It doesn't specifically help RAD, but it helps those symptoms that may be associated with conditions with RAD, like depression or anxiety or ADHD, which is often seen along with this condition.
All right, let's take a quick email. This is from another viewer. I have a child diagnosed with RAD. He does things that make me so upset. I find it really hard to control myself. What can I do?
You've heard that all too often, really. It's vital that the parent takes care of themselves. If they're emotionally drained and spent, then they're not going to be able to be effective in working with the child. They need assistance and support from professionals. They need to be well taken care of.
Do a lot of parents tend to take it personally? I mean, is that kind of just a common reaction?
How could they not?
Yes, I mean, the idea is I'm going to adopt this child, I'm going to give them love, and I'll have a loving child back to me.
Right.
It doesn't work that way with RAD children. They do everything they can to destroy that relationship, to test it. They don't trust it. Therefore, they don't let anybody in. They're like a turtle with their head inside their shell. They don't let anybody inside to really get to know them, because that would lead to further pain.
So this is how long does it take, if ever? I mean, do you really get a child over this?
It depends on because attachment disorder is on a continuum from extremes. So one extreme, you have really severe pathologies. The serial killers are tend to have attachment disorder, severe, but it's a continuum to something just mild attachment issues. And so again, it depends on the severity.
Yeah.
So an early diagnosis as
and
fast
treatment,
as
and
possible.
treatment, yes,
and long-term treatment, yes.
All right, we're going to take a short break. We'll be back with more questions for our doctors right after this. You're watching Community Psychiatric Centers Presents on PCNC.
As a parent, you want what's best for your child. And that can mean asking for help if your child has problems at home, in the community, or at school. At community psychiatric centers, our highly trained professional staff offers mental health diagnosis, treatment, and therapy to your child in their natural environment, at home, at school, in the community, or at one of our 11 southwestern Pennsylvania locations. One phone call can change a life. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
I've been at the station a long time. I've covered a lot of important stories, and I know you want an experienced news team that's been there, covered all the angles.
Live coverage.
The news is important, but what's really important is how it affects you, how it affects me.
Local news.
Many of the stories that we tell affect people's lives, and it's our job to deliver the news that you need day in and day out.
Local news is what we're all about. That's all we do, really. Local news.
Welcome back to Community Psychiatric Centers Presents. We've been talking this half hour about adoption and some of the issues that can accompany it, including an attachment disorder. And doctors, are the treatment regimens the same for RAD as for other disorders?
Well, not entirely. I mean, children with RAD are, as we said, don't trust, don't have the ability to express feelings and needs, often lie, try to manipulate their environment in negative ways, and these are important things a child needs to do to be in the traditional treatments. Treatment with RAD involves more family involvement in treatment. The approaches can be outpatient therapy. Wraparound services is particularly helpful with RAD because the therapist can be in the home with the child and parent and work with them together in that setting.
Which is vital, given the fact that we talked earlier about how emotionally draining it can be trying to help a child and trying to raise a child with attachment disorder issues. And having the therapist right on site through wraparound services can be tremendously helpful and supportive for a parent, and also provide the model for them right there, right then, right as it's happening, with the right words to say, the right approach, the right tone of voice, the right body language. Vitally important in the natural environment to have that happen. Outpatient counseling is helpful as well, but typically it's going to include the primary caregiver and the child together, because that's who we want to contribute to the bond with, those two.
Now, I know that one of the pushes for adoption is, in many cases, adopting older children, because sometimes they're the most difficult to adopt. What can you say to parents who would like to do this, but may be concerned that these things happened, 5 years ago, and can they be fixed?
Well, it's a riskier situation to adopt an older child because you don't know what their history is and you don't know what they bring to the family adopting the child. Clearly, the more you learn about the child, the more you get to know them before the adoption process completes, the better.
But the fact is, 80-90% of adoptions are wonderfully successful, everybody's happy, and they go well, and that's the important point.
All right, we will leave on that note.
Yes.
And doctors, thank you for being with us, and thank you for watching. We'll see you next week on Community Psychiatric Centers Presents. Good night.